Hi, my name is Shelby and I'm going to be your student nurse today, and I'm here to perform your wet to dry wound dressing change. And before we get started, I'm just going to close the curtain for our privacy, or your privacy. Okay, and before we get started, can you tell me your name and your date of birth? Okay, Mr. Jones, thank you. And do you have any allergies I need to be aware of? None? Okay. And can you tell me how your pain is from a scale on 0 being no pain at all to 10 being the worst pain? 1? Okay, just making sure, just to make sure you're not feeling any pain beforehand, because if you did, I would give you some medication. Okay, before we get started, I'm going to perform hand hygiene. And yeah, so I'm going to raise your bed. Are you doing okay today, Mr. Jones? Good. Okay, and I'm gonna lower your side roll. Okay, and I'm gonna get my equipment ready. Get my bag ready. I'm gonna cuff it. Just put it right there for me. And I'm gonna drape you really quickly. Put a drape right here. And I'm gonna prepare your tape really quickly. Okay, we are good, and I'm going to make sure I have all my supplies. I have my sterile kit, my solution, my measure. Okay, I'm going to put on some gloves. Okay, Mr. Jones, I'm going to remove your dressing. Okay. I would note Mr. Jones's the drainage on the dressing. I would note the amount, the color, and the odor of it. So now I'm just going to put this in my biohazard bag. And now I'm going to assess the wound bed color, the edges of the wound, how the wound is closing, and if there are any drains present. Okay, Mr. Jones, everything looks good thus far. I'm going to remove my gloves, perform hand hygiene, and now I'm going to prepare my sterile field. My sterile kit has not expired yet, and neither has the solution. Wash my hands again since I touched it. Okay. Let's see. Get my sterile gloves. Just gonna put them right there. Now I'm gonna take my sterile solution, have the label facing me. I'm gonna pour it in. Careful not to splash or let anything drip. Okay. And now I'm going to put on my sterile gloves. Now I'm going to take the, now I'm going to clean your wound for you. Okay. Now I'm going to clean it down the middle from the least contaminated. There we go. Do it to the left side. Now I'm going to do your well, I just did the right side. Now I'm going to do the left. Very good. Okay. Now I'm going to take another piece of gauze. I'm going to take one of my Q-tips and I'm going to measure the length of the wound. Okay, 14 centimeters is the length. The width is 3 centimeters. And now I'm going to moisten it. And the depth is 2 centimeters. And now I'm going to check if there's any tunneling. No tunneling's present, Mr. Jones. Awesome. So now I will take my gauze . I'm gonna wet it. Take my other Q-tip. And now I'm gonna pack your wound. Now I'm going to take another gauze, wet it, now I'm going to pack this one. Okay, Mr. Jones, now I'm gonna put the Q-tip in the biohazard bag. I'm gonna take one of my gauzes. I'm gonna wet it. Okay. Now, put it on you, wet. dry one and a dry one. Okay, and now I'm going to take my ABD pad and place it on top of you, and now I can take off my sterile gloves. I'm going to go up. Okay, and place these in the red biohazard bag, and now I'm going to place some tape on you. And now I would date, time, initial it. I'm going to perform hand hygiene. I'm going to raise your side rails and lower your bed. And how are you feeling, Mr. Jones? Are you feeling well? You are? Okay, good. Just making sure. Okay, you're all the way down. And now I'm just going to clean up, put that, and now I'm going to put on gloves. Okay, I'm going to clean up my area really quickly. You did say you were doing okay, Mr. Jones? Okay, good. Okay, Mr. Jones. Well, here you go, and here's your call light. Your bed's lowered. I have your side rails up. And let me know if you need anything. Just call, okay? Thank you. Okay, now I would put this where it needed to be, dispose of it, remove my gloves, and perform hand hygiene. Now I would document how the patient handled it, or document my findings, the drainage of the wound, the amount, the color, and the odor. I would document the wound itself, the wound bed, and the color. I would document the edges of the wound. I would document the closure of the wound, and I would document if there was any drains. I would document the length, the width, and the depth, and if there was any tunneling of the wound, I would document how I cleaned it, and I would document the dressing, that I put the dressing on it, and then I would document that how the patient handled it. So yeah, thank you.